when we have that history of repeated miscarriages and nothing is explaining it, and then we do a few tests, and then I believe in not going vertically into one thing that you just keep checking one side of immunology, but I go horizontally and I check antibodies, Th1, Th2 ratio, NK cells, DQ alpha. There are, it's just, it makes more sense to go horizontally and do one basic test for like endometrial immune profile. There's a new test called KIRS in which the sample goes to Chicago, and we wait for a couple of weeks, and all this. So we check a bit of every side, that is there anything wrong, and obviously it is guided by the history of the patient. For example, someone has thyroid issues or someone has massive diabetes history in the family or herself, I would think of making sure that there are no antibodies of other nature in her body. Similarly, my other decisions are guided by that, but we try to, that makes us very unique, by the way, that as a team we try to not go too deep into one thing, but we try to check everything horizontally and find out if some area is the problem area, and then we go deep into that, depending on how patient has to accept that this whole thing actually is not based still on massive evidence, but it is still experimental in nature. And that is the information the patient needs to know. And then she can go ahead and test more and treat more. There are various modalities. Some of them can have side effects like allergies. So it has to be very carefully selected. There are various modalities like use of intralipids or lid therapy. All those things have to be very carefully selected in a very small subset of patients only. They should be very carefully given, not to everybody who has miscarriages, for example. And there are other tests like LAD, and in which we, check the partner's blood also, and see whether there is a problem in the, HLA and the other areas. Why is the women's body not accepting the baby, especially when it's an early miscarriage and repeated, and there is no other problem. So all these patients, if not tested, will be labeled as unexplained in otherwise a standard fertility practice, which is not doing a very advanced practice that includes reproductive immunology. But I have to emphasize this, that this is only beneficial to a small subset of rightly selected patients. And not everyone should be spending thousands and grands of pounds just without any genuine rationale behind that.